Today we are going to talk about how to save your kidney in diabetes. In diabetes mellitus, the kidney involvement is a very important thing, and almost 20 to 50% of diabetic patients will have some degree of kidney involvement. It goes on as the duration of diabetes increases, the involvement of kidney also increases. So one needs to know and one needs to protect our kidneys from diabetic damage. In diabetes now, it is the most important cause of chronic kidney failure, where people are actually going for hemodialysis or they have to go for dialysis, and we need to avoid that. First and foremost important thing is to know and to check whether kidney damage is happening, because kidney disease is a totally silent thing. Large number of people will not know even if the kidneys are getting involved. Even if the kidneys are getting damaged, to large extent there cannot be any symptom. So many patients do not have any symptoms at all, and they only land up with high degree of kidney failure. So to do that, we should do certain important tests. It is important that KFT is not enough. So very often people do kidney function test and they think that is sufficient, and if the kidney function test is normal, they are not having any problem in their kidneys. But we need to do more things. You need to assess whether there are microproteins which are leaking in the kidney, and that is one of the earliest symptoms of involvement of kidneys in diabetes. Once you do that, you will know probably there is some kidney damage happening. It is recommended that we should do this sort of test at least once when new diabetes is detected. Also, it should be repeated annually along with other kidney function evaluations. In case there is some problem, you may need to do it more frequently. Once we have determined that there is a kidney damage happening, what to do really to avoid kidneys from getting damaged further? First and foremost is control of sugar. So we have to control our sugar. A is for A1C. We have to control our A1C as close to 7 as possible, or your doctor may decide what are your targets. Blood pressure control is also very important, and a blood pressure of systolic 130 is good for protection of the kidneys. And again, you have to be very meticulous about controlling your blood pressure. You may need to do certain other tests which may be for infection or for obstruction in kidney, and in case of need, you need to go to your diabetologist or your nephrologist well in time for follow-up. If we take all these precautions, we can save our kidneys and we can save patients from going to dialysis.